Good morning, Virginia. My goodness, you are a smart cookie here, girlfriend. I didn't brush my hair, I didn't brush my teeth, but whatever. I will be washing my hair today because Luigi's coming up to see me. What a scary sight. Virginia, I didn't know POTS was associated with, I didn't know mitral valve was associated with POTS, but when I just Googled it, mitral valve is associated with dysautonomia, which I can't say it in English, which I have the two different problems of dysautonomia. But I just found this website, and I'm going to read this article. My goodness, girlfriend, thank you. I didn't know this. What is dysautonomia? Symptoms associated with MVP syndrome and dysautonomia. And I don't know. Oh, mitral valve prolapse. Ah, that's SVP. And I had surgery for it because mine was so severe. And right now there's a very small leakage. Mitral valve's prolapse is so named because a slight, very slight posterior motion is seen as the mitral valve closes. Now, mine was not mild and slight. Mine was severe and eccentric, is what they had called it. The mitral valve is designed to undergo significant movement as it opens and closes during the cardiac action or flexibility. It is not harmful and causes no damage to the heart or the body. The action of the valve moving. It's supposed to. The array of troublesome and often frightening symptoms which may be seen from time to time in people with this valve movement is not due to the extra motion or the prolapse of the valve. Mine did such a severe prolapse. It acted like what the doctor said is it closed, and that's how they misdiagnosed me. It closed, and they saw all the blood being pushed out, so they thought, oh, it's not leaking. And then at the very last minute, the valve flung back in this eccentric motion and then just flooded the chamber to the point where I ended up with 70% regurgitation. When I was pregnant, there was 100% regurgitation. My jugular vein was jumping. After the pregnancy, it went back to 70-something, and before they did the open heart surgery, I had 70% of my heart turning around, going in the wrong direction, which then made that one chamber grow to 200% too big because new blood was coming in while 70% was washing back. Okay, the associated symptoms might include dizziness, numbness, chest pain, pressure, palpitations, anxiety, sleeplessness, gastroness, bowel symptoms, actual diarrhea, mood swings have been termed with this. These symptoms are not due to the prolapse of the valve itself. Many individuals have come to recognize that prolapse of the mitral valve, parentheses, the other valves of the heart, can similarly, prolapse as well, is just a marker, an identifier for a person with this complex of symptoms, and not the prime cause of these symptoms. I've not heard this before. Because there was controversy, and I asked the doctors again, was I born with mitral valve prolapse, and this was a birth defect you found at 4, or did I get rheumatic fever, which is one of those viruses that damaged the heart? And the two surgeons that thoroughly examined my heart both went down. One held the ground and said, you were born with this. The other one says, no, Francesca, this is Barlow. Well, the one who said I was born with it says it was Barlow bileaflet mitral valve prolapse. The other one says, no, you got rheumatic fever. But, and I asked the doctors this week, and they said, Francesca, there's no way to know. The only way we could do is give you a rheumatic fever blood test. If it came back negative, then it means you never had rheumatic fever. If it comes back and says you never had rheumatic fever, then it means for sure, beyond a doubt, it was Barlow bileaflet and you were born with this. If it comes back positive that I've had rheumatic fever, then there's no way to know which it was, because now that I've had the heart surgery, they've altered in shape, the shape of the heart, and no one can know. All right. Most often, these and other symptoms are clearly related to the excess drive of hyperfunction of the autonomic nervous system, which can be thought as automatic nervous system. This system controls functions of the body such as pulse rate, which is what I'm having a problem with, a very low pulse rate, which is different than blood pressure rate. my blood pressure is good, but the pulse rate between the top and the bottom number like almost don't even exist. There's 8 to 10 point spread. Breathing, digesting, blood sugar, the size of our pupils in dark and night, the dilation of the peripheral blood vessels under hot conditions, and contractions in cold conditions. It is related to our state of anxiety, sleep, and wake conditions. It is both the stress nervous system and the digestive nervous system having two states which are normally fine-tuned and balanced. We are quite familiar with what our body does under stress, such as before giving a talk, performance, an examination, an important interview, or before an anticipated stressful event. We often have sweaty yet cold hands, hard pounding of the heart, slight breathlessness, dryness of the mouth, increasing frequency of urination, looseness of bowels, and if measured, some increase in our blood pressure. This familiar pattern of behavior of our body is due to excessive adrenaline and similar hormones from the autonomic nervous system as a result of stress. The anticipated event has gotten our juices flowing. This is the response of our acute body stress. After the event is over, sensations experienced prior to it generally subside. We have met the stress and dealt with it, diffusing and halting the stress hormones responsible for it. However, certain individuals with perhaps more moderate levels of stress continue experiencing bodily stress sensations of the stress syndrome on a more regular basis. It is as though the stress hormones remain tuned up, or our bodies respond to these hormones with continuing stress symptoms. These individuals seem to have a more reactive or hypersensitive autonomic stress nervous system. This had led some researchers to call the syndrome Dysautonomia. It is of interest that many patients with mitral valve prolapse have or are subject at some point over the years to have symptoms of dysautonomia. Similarly, certain percentage of patients with dysautonomia or mitral valve prolapse have other related findings such as scoliosis, curvature of the spine, which I have, small, usually mild, or a bony chest abnormality such as a pectus excavum. But I've got a mild scoliosis. My sister has a severe scoliosis. Many women with fibrocystic breast problems and excessive premenstrual symptoms. I have fibrocystic breast problems. That's why I'm having the MRI next week. And even temporal debular joint problems, TMJ, which I've got that. Thus, it seems clear that the tiny movement of the heart's valve is not at all causing these manifestations of a syndrome encompassing many body functions. Perhaps there's a good reason to have called this complex symptoms of dysautonomia or mitral valve prolapse to indicate the understanding. Wow, I wonder who this guy is. Trying to see. Richard, oh, he's a doctor, for what it's worth. Dysautonomia. Okay, at least I'm saying that right. He spelled that out. I'll put that link down there for you guys. I'm going to go ahead and let's see if I can find another one. That was a good little thing, and that was from the Society of Mitral Valve Prolapse. So, you know what I'm going to do? I want to see if this exists. ME/CFS and mitral valve prolapse. And here's health boards. Somebody has got, I've got ME/CFS and I have mitral valve prolapse. Phoenix Rising. That, yeah, there are people. Look at that. There are people. I didn't even know this, Virginia. So when somebody starts talking about things they don't know about, clearly, I mean, I'm really well read. I know the specifics of my papers. I look up the specifics. I talk to my doctor friends. I have many medical doctors that are following me. There's no way someone who knows nothing about this illness can render any opinion, because look at this. When you put in mitral valve prolapse, which is another trigger, there's a correlation. There is a correlation. I didn't know that. I know that the mitral valve prolapse, a lot of women have, but it doesn't necessarily get bad on a lot of people. But it obviously did get bad on me. Interesting. You know what I'm going to try and do here? Let's see if I'm going to put in PubMed. PUBMED. Okay. Should have probably gone directly to Ireland cardio risk. Ooh, I wonder if those are on the same page. Hold on a second, you guys. This is an ME-CFS. Ooh. Campaign for cross-border ME-CFS. Abnormalities. It's, oh, this is Harvard University. And he has an article here. Why myalgic encephalomyelitis, chronic fatigue syndrome, may kill you. Disorders in the inflammatory and oxidative and nitro something stress pathways may explain cardiovascular disorders. And that was an article written in Belgium. Cardiac involvement with chronic fatigue syndrome. And that, I don't know what country. This is interesting. I'll have to research this, but you know what, you guys? For those who know nothing about nothing, and for those of us who are trying to learn with valid information, there's absolutely a correlation with numerous types of heart issues. They haven't been able to define them. PubMed is only one resource for where medical papers are published. Medical papers are published in all kinds of locations. There's then the PubMed version just for the heart, or just for viruses, or just for eyes, and sometimes they get published in those medical report areas and don't make it to PubMed, but I know this. And I also know that there's reports that are done in other languages that the people can't get translated to English, so they don't arrive in English. So I have learned to go to these other countries. There was actually a guy that wrote a paper in Norwegian, I think it was, and I contacted him, and he gave it to me in Norwegian. I put it in Google, which translated it, and then I went back phrase by phrase, and I cleaned it up, and I translated his medical report into English and sent it back for him so that he, in fact, could put it on PubMed. So, although PubMed is absolutely the #1 source for articles, it is not all-encompassing and exclusive to the only articles. There are many articles in many locations that these doctors around the world a lot of times don't have the will, the capability to get it put into English or even get it registered. Who knows if they have to pay to get it registered in PubMed. So just now, I just found an interesting site that had was done by the Harvard University, who started to find papers from around the world that are on ME-CFS. Anyway, you guys, I am going to take a shower today. My house is totally clean. The house cleaner came. I did find out my heart got a really, really good report, but there was a mild, like a mild heart attack. When I went to the very last piece that needed to be translated, the septum wall in between the two chambers, the two upper chambers, two bottom chambers, and there's a septum wall, has had, not mild, the word was moderate, medio, which is medium in Italian, damage. Which means, I tried to ask yesterday, when I suffered the VTAC, I guess I should Google and try to see whether, he said, we can't have an answer for sure for that either, Francesca. I said, did I have a silent heart attack? Or, there's other times when I've had chest pains that I swore they were heart attacks, but I just let them go. Maybe it was an actual heart attack that I identified the pain and let it go because I've had so much chest pain I thought nothing of it. Or maybe it was when I had the SVT which we know I'd had more than one, could have done it, or maybe when the heart was backed up on the regurgitation, could have done this damage. But what would be called a medium heart attack, well, no, it would have been a heart attack with medium damage. Not severe damage, not damage in all of the heart. It's one specific area, and that area is damaged in that one area. So it's okay, but at least, and Climas was the one who found that, actually. When Climas had run the heart tests on me, because they have very sophisticated heart machines down there, she said, oh, you had suffered a heart attack. And I went, heart attack? I knew I had a ventricular tachycardia, always supraventricular tachycardia, had some weird other fibrillation things, which I've not told you guys, these other fibrillations. I've got a bunch of other heart rhythms. And the bottom line is when your heart gets bad enough, it just starts doing other things. But Pierluigi's going to come up for a couple of days, and I also just saw my ex-husband is going to come in, which I'm really happy for him to come in to see my daughter. Really happy to see him, have him come. He's a fantastic cook, my ex-husband. Just unbelievable cook. The only problem is last time I had the heart surgery, he leaves everything a mess. He's a pig, he's dirty, and I cleaned, and I ended up stroking. And now I'm going to be having the heart surgery probably right before he comes again, and he's going to be in the house. And the problem was I had left him for 3 weeks and 2 weeks in the house alone when I went to go have the heart surgery, and came back and the house was a fucking mess. And then I started cleaning and I started stroking. So if I can get the surgery done before I go, before he comes, and I have a babysitter staying here, I know the house will be maintained clean. And then when I come back, if I'm in the house while he's in the house, then I can make sure that between maintaining a house cleaner and saying, pick up your shit and move it into your area, and you keep all your shit in your area, and I don't want any of your shit anywhere else. Keep all your shit in that area. Then that means, and that's probably, we have to clean the art studio anyway for Antonia for her birthday, and whether the babysitter wants to sleep in that area. Now we got him coming. So, but what I'll do is I'm going to tell Pierluigi he's got to help me set up the art studio to be a functional little bedroom. I'm going to make him work with me. I told him last night that with me getting sick again and knowing I needed the surgery, I started thinking maybe we shouldn't proceed. Maybe we should not see each other and just let it go, because, you know, granted, he's been around, he was overlapping when Gilda was here, and I heard from Gilda yesterday, too. I was in the hospital in November. I met him in October, November. Met him probably early November, Pierluigi. And then I met him in person in December, although we kept doing the, what do you call it, like Skype, but it's not Skype, it's Facebook video camera. And we've done it for ages, and I've seen him numerous times, numerous visits. Anthony really likes him. And he took care of me in the hospital. I was teasing him yesterday. I said, "See, you mean," because I was kind of telling him maybe we should just not, you know, maybe we should, you know, why the hell do you want to date somebody who's sick? And I'm going in for heart surgery, and, you know, do you realize what you're getting into? I mean, and I always feel like I have to put this disclaimer on this with these men, and that's fine, that's not a problem, that's fine, Francesca. I even said to him, you understand right now I'm not interested in sex, so, you know, it's not like you're going to even get that. I don't feel good. No, that's fine, Francesca. You know, there's always the hope. So, and I've gone out numerous times with him, and he visited me at the hospital, and he was what we call my toilet paper man, because the hospital had no toilet paper. And I said, well, you know, if I go to the hospital down there, I'm going to need a toilet paper man, and I need to know now, are you on call for toilet paper duty, or do I have to find a new man to be my toilet paper man? He said, okay, Francesca, thank you for letting me know I'm your toilet paper man. And that's when I told him that Paolo used to be my bagaglio, suitcase man. And when I ended the story with Paolo, and I said, Paolo, do you have any advice for the next man being with me, what they should know? And he said, yes, I have some very strong opinions. I said, okay, tell me. He said, if you tell them, if you ever ask them to help you with your suitcases, could you possibly pick me up at the airport? Have them tell you no. Because the minute they say yes, they're on the hook to pick you up with your suitcases forever. So it's really funny, funny, funny. So he was my bagaglio, ragazzo di bagaglio, my suitcase boy, because Paolo was younger than me. And so right now, Pierluigi has become my toilet paper man. So we'll see. He's going to come up. He'll spend a couple of days up here. We're going to get the art studio set up for him to stay in the art studio. And he knows what he's biting off. He does seem pretty calm and patient. He's older. He's 61. You know, here I go from the stud muffins younger to Carlo my age to 10 years older. And yeah, it was funny. A guy yesterday at the bar said, "You shouldn't be with a 61-year-old too. You're too young and perky." And I said, "I'm 51. He said, "Well, then that doesn't matter. You need a 40-year-old, and you need a 40-year-old that's in good shape for you. You don't want a 40-year-old that looks like a 50-year-old. I said, "Okay." And he said, "But you could have a 50-year-old, but the 50-year-old's got to look like a 40-year-old. You understand? You need to be with a 40-year-old, even though," I said, "I'm sick. You have no idea that even though when people see me out and dressed up, and I didn't have makeup on yesterday, but, you know, they can't believe I'm sick, and my personality doesn't show it, you know. Except for this past week, man, have I been crying. Crying, crying, crying. I went underground and was with Deb on Skype I don't know how many times. This really set me back. But I got the cardio thing done. I'm going to get the surgery moved up. My sexy doctor friend Maurizio explained to me it's not my fault, because subconsciously I was feeling like it's my fault. And then I was reading that Buddhist book. Be peaceful, sweet body. Boy, I can't remember. Be peaceful, sweet body, trying so hard to support me. And that's really what it is my mind and my hopes and my desires want so much. And I'm forcing my body to try to do more than it can do, because my mind doesn't want to stop living. But Deb is such a doll for talking about these things with me. She so understands. Such a wise, wise, wise woman. We call it a sage in Italy. Saggia. What a wise sage she is, really. Wonder how many other lives she's lived. Okay, you guys. Virginia. Thank you. I did not know that was an existence of a correlation. Thanks, Virginia.